Great. So I think we can get started. Welcome, everyone. My name is Matthew Kusin. I'm a senior technical advisor with the Skippa 2 project, working at Health Equity Matters in Bangkok, Thailand. And so today we have the pleasure of sharing with you a webinar around demand generation in the digital age. We'll be covering gaps, innovations, as well as a panel discussion around the future with AI. And so just in terms of today's webinar, this is part of the Skipper 2 learning series. Skipper 2 is the sustainability of HIV services for key populations in Southeast Asia. And really the learning series acts as a platform for across our region to really focus on building knowledge, knowledge sharing, fostering peer-to-peer support. In today's webinar, we have three main objectives. The first is around raising awareness of the existing gaps in virtual HIV services in our region. And so we all have Nikki Suwandi sharing a bit about a recent assessment that has been undertaken as part of the Skipper 2 program. Also looking to highlight the effective best practices and innovations around demand generation for HIV services through virtual interventions. So we'll have two presentations from Indonesia as well as the Philippines from two of our partners, as well as we'll have facilitated panel discussion around key implementing strategies to scale up and improve virtual interventions, as well as a discussion around leveraging new technologies such as artificial intelligence. So without further ado, I will introduce our first speaker and host, who will be setting the scene. So Purvi Shah is a technical consultant working with WHO's global HIV, hepatitis, and STI program in Geneva, as well as with the UNAIDS regional support team in Bangkok. And her major focus is supporting countries in Asia Pacific and Africa on innovative testing, virtual interventions, and artificial intelligence. Over to you, Purvi.
Thanks very much, Matthew, and good afternoon, good morning, good evening, wherever you are. Just want to take this opportunity to welcome you all to this crucial topic of utilizing virtual interventions for demand generation of HIV services, also looking at a lot of innovations and speaking a little bit about artificial intelligence. I think we are extremely excited to have you join us today as we explore our innovative strategies that are transforming the way we engage with our communities, improve accessibility, and ultimately enhance the outcomes for individuals affected by HIV. In the recent years, I think we all understand that the landscape of healthcare delivery has actually been, rapidly evolving, and the COVID-19 pandemic actually accelerated our reliance on virtual platforms. Now, more than ever, we've had the opportunity to leverage technology to reach vulnerable populations, educate communities, and also to create a supportive environment for those seeking these services. As you must be aware, and the latest statistics actually tell us that there are about 5.45 billion internet users globally, and about that accounts for about 67% of the total population that we have globally, and they spend around 6.5 hours on the internet. And it also says that 83% of the young population from the age group of 16 to 34 actually use the internet for making health choices. Now, that's a huge number of people looking or being reliable or relying on the internet to understand or become aware or get information about health services, and also then choose the service that they want to uptake. So our discussions today will actually focus on effective virtual interventions, best practices, and some successful case studies that have demonstrated significant impact in the realm of demand creation for improving HIV care, some innovations, and also talk about artificial intelligence. So demand creation, as most of us that have been working with HIV programs understand that it's the first and the most important step towards bringing someone into services. I think effective and accurate demand creation ensures better conversion rates from virtual platforms that we reach out to these populations and to actually bringing them to services. Since most of the populations now use social media platforms and dating apps to connect with friends, clients, and even partners, it is extremely crucial to reach them on these same platforms. Social media and the internet has a huge amount of content that is available for free. But how do we make this content more reliable and based on the needs and preferences of our target audiences is something that we all need to understand and learn and be open to experiment or innovate when it comes to these topics. Now, as we embark on this journey, I would also like to highlight that artificial intelligence also now plays a crucial role in enhancing health program needs. AI provides us with powerful tools to analyze data, predict trends, personalize outreach efforts, ensuring that our interventions are both effective and targeted at the same time. From improving client engagement through tailored messaging to streamlining service delivery, AI stands as a vital ally in our mission to eliminate barriers and also foster a healthier future for all. Thank you for being here today, and I look forward to an engaging and enlightening discussion with our esteemed speakers and panelists. Let's get started with this. Um, as Nikki mentioned, and also Matthew, I think there is a wonderful lineup of speakers today that we have with some exciting results and exciting things to share with us. The first speaker that I'd like to invite is Nikki Swandi from AppCom. Um, Nikki is the Knowledge Management and Innovations Officer at AppCom, a regional network organization focused on the health and rights of gay men, other men who have sex with men, and diverse SOGISC people in Asia and the Pacific. His work primarily focuses on HIV virtual interventions, HIV prevention, especially PrEP, and sexualized drug use or chemsex under the Global Fund Skipper 2 program. Currently, he also serves as one of the 3 elected civil society organization representatives on the Long Acting PrEP Coalition Steering Committee, a global coalition hosted by AVAC, with a collective mission to accelerate access to long acting PrEP options for communities who need them the most. So, without further ado, I'd like to invite Nikki. There were a lot of abbreviations in your in your in your introduction, but I think most people understand them, and everybody knows Nikki, so I don't think he needs a very detailed introduction. So over to you, Nikki.
Thanks, Puri. Thanks so much. So I hope some of you already know me. Maybe just from the email that I consistently send for the webinar promotional as webinar promotional efforts. Maybe some of you getting sick of of receiving email promotional from me. But anyway, hello. Again, my name is Nikki. I'm the Knowledge Management and Innovation Officer. I'm an Indonesian currently based and living in Bangkok, working with Appcom. So under the project, where's my slide? So under the Skipatu project, the project that I'm doing, so we've done this assessment of HIV virtual intervention in Bhutan, Mongolia, and Sri Lanka. Next slide, please. So Matthews talk a little bit about SKPA. SKPA is a program under the Global Fund with the support of Global Fund. Health Equity Matters is the principal recipient, and APCOM is one of the SR or sub-recipients. SKPA2 is a multi-country catalytic grant for Bhutan, Malaysia, Mongolia, Philippines, and Sri Lanka. So under the SKIPA 2, there are 4 objectives, but this assessment is particularly under objective 3, which is promote programmatic sustainability. And why we're doing this assessment, as you can see the objective on the screen. So yeah, next slide, please. So for this assessment, we did a mixed method approach, including desk review of relevant documents, key informant interviews, focus group discussion, and we hire a regional consultant, my friend and also colleague, Dr. Jonathan Fontila, who supported and also supported by a bunch of country consultants to help with the data collection, ensuring the comprehensive and culturally relevant insights. So this assessment actually we start in October 2023 and we conclude in July 2024. I know it's a long time, but there was a significant pause during those times. Next slide, please. Oh, by the way, we also, for this assignment, we got an abstract presented at the International AIDS Conference a few months ago in Munich, Germany. It was great that we can share this assessment with the communities and other stakeholders who were there at the biggest AIDS conference in the world. So just cut to the chase that for this assessment we got a few key findings. The one of the key findings is that the effectiveness of virtual health intervention are really varied across countries, because there are differences in either infrastructure and policy support, as well as how people in this country uses the internet and digital literacy. So if you can see on the table, there's in Bhutan, like there's no mention of virtual intervention in any official document, and no domestic resources, as well no guidelines or SOP in the country. So just like the situation in every country is like different. And then virtual platforms, including social media, mobile apps, and websites, are actually being used for HIV outreach. However, more targeted and engaging content is needed more, so we can reach high risk population more effectively. Next slide, please. So we found out that the virtual intervention is improving access to HIV services, but stronger connection between virtual platforms and the clinics are needed to ensure continuity of care. If you can see the table, good referral systems are adequately available across the 3 countries, which is good. Next slide, please. So while telehealth services such as virtual consultation and online prescription are increasing, however, safety and security issues like confidentiality still become a barrier. If you see the table, good to know that virtual HIV self-testing delivery is available in all 3 countries. But few crucial items need to be established in Bhutan, including some basic ones like or online ordering or other form of safe spaces and deliveries of condoms and lube for communities who need it the most. Yeah. Next slide, please. So I know I shouldn't include this table, maybe it's too confusing. So, community-based organization or community-led organization playing key role in delivery of specifically tailored virtual intervention for our key population. These interventions leveraging trust from the communities and connecting the missing dots or the hard to reach key population, not casually identified by conventional face-to-face outreach or hotspots. You see the table, I know it's confusing. The intervention available, mostly catering to the needs of MSM, transgender persons, and also sex workers. Next slide, please. So, those are the key findings, and then the assessment also provides some recommendation, which is to build partnership with government, private sectors, and international organizations to scale virtual HIV intervention while ensuring accessible on-the-ground services, including innovative models like online reservations and case management apps. Other recommendation is to empower CBOs or community-led organization to lead virtual HIV intervention by providing technical support, training, funding, and continue engaging key population through familiar virtual platforms like Facebook, WhatsApp, or other platforms that are really popular in each country, which might be different from country to country. Next slide, please. So, health service providers should utilize popular social media platforms and dating apps to increase HIV outreach. It should be catering to specific needs of the community. For example, build partnership with Grindr or Hornet, so communities can do ad placement at the maybe discounted rate. to reach the MSM community and also transgender women community. Also, phone-based services still recommended, like hotlines and SMS services for wider community engagement. The other recommendation is to improve access to PEP, and community-based HIV testing while enhancing online service booking for testing and treatment and integrating services into virtual care. So no, so one-stop, not no. So one-stop support or comprehensive support could be established. Next slide, please. So another recommendation is to create a user-friendly digital platform that provides a range of HIV services, from information dissemination to service delivery, with options for ordering ART and other essential commodities like HIV self-testing kits, condoms, loops, and others. It's really recommended using community organization as a pickup points and build partnership with various stakeholders, clinics, pharmacies, as well as private sectors like maybe courier services or what do you call that? Right application like in Asia it's popularly Grab. Yeah. Yeah, two more recommendation is to improve virtual HIV intervention by adapting the CLM system to these platforms, CLM, community-led monitoring, using feedback and social media analytics to refine services while maintaining privacy and data security. And the last recommendation is also about ensuring data security and confidentiality of community-specific data, which might be sensitive. So next slide, please. And from this recommendation under the SKIPA 2, we implement some activities. For example, in Bhutan, the PrEP virtual demand creation, APCOM and Save the Children Bhutan conducted workshop in July 2024 with 4 community-led organizations in the countries, where we discuss basic demand creation, including social media use, branding and presence, and also basic design. And all these training activities is to accommodate the official PrEP launch on World AIDS Day 2024. Just to note, Bhutan and Sri Lanka might be late for PrEP implementation, and virtual intervention is a relatively new approach for the country, but it's better late than never, right? Me personally, I'm really excited that Bhutan finally have this powerful HIV prevention tool. In Mongolia, so there are plans to actually revise existing national guideline to accommodate support for a digital or virtual mechanism. This is planned for the year 3 of the SKPA program, which is now until June 2025. Also, there's a plan to develop SOP or standard operating procedures specifically for virtual HIV self-testing services for men who have sex with men and also transgender women. A consultant will be hired for this, and the SOP will help formalizing virtual HIV self-testing services. Last but not least, in Sri Lanka, the SR in Sri Lanka already identified an agency who will develop digital material to address the top common questions or frequently asked questions on social media to bust myths and misinformation within communities about HIV, PrEP, HIV self-testing, and ART. So it is like more comprehensive on the prevention and treatment and care. So agency, along with APCOM and Health Equity Matters, will collaboratively conduct training and equipping community-led organization with the necessary skills and knowledge to use the materials that were developed for future intervention and campaign. So training will include how community can use digital tools and how to use social media for dissemination and promotion of materials using popular platforms like TikTok, Instagram, Facebook, and YouTube. So I think that's the end of my presentation. Sorry if I am over time. Thank you so much.
Thank you so much, Nikki. I think this was extremely important, this exercise that was conducted earlier this year, I think gave us a lot of information about, where we are in terms of virtual interventions, and the recommendations, I think, would be extremely important for countries to learn from and, plan their next steps. Moving on with the next presentation, we have Tono Permana from Kasih Suwitno Foundation from Indonesia. Tono is a passionate advocate for HIV awareness, born and raised in Bandung, Indonesia. He began his journey as a volunteer in HIV programs in 1999 during a time when HIV was becoming a significant public health issue in the country. In 2007, he founded the GWL-INA, not that I understand this, but maybe he can give more information. Indonesia's national network of MSM and TGW individuals, serving as executive director until 2015. Tono worked as a UNAIDS consultant from 2015 to 2018, providing expertise on HIV programs. He's now the head of Yayasan Kasih Suwitno, focusing on HIV and MSM issues, strengthening health facilities to provide MSM-friendly HIV and STI services, and using digital platforms for demand creation through the foundation's flagship campaigns such as Saya Berani and Tanya Marlo. Over to you, Tono.
Thank you, Purvi. Hello, everyone. Yes, my name is Tono, and I'm here actually to replace my colleagues who actually has the responsibility to manage the digital platform, which is Saya Berani and Tanya Marlo. And until now, Saya Berani and Tanya Marlo seems the most popular. I don't know. There is also Tanya Berani and the SJKT, but we are very active and progressive and providing information about HIV and SRHR. So, okay, Nikki and friends. So I would like to to give presents our experience on managing or operating the Tanya Marlo. Tanya Marlo and Saya Berani is the brother and sister actually. So now we have the opportunities from the AIDS Funds and Elsevier Foundations to improve and the digital platform Tanya Marlo with the objective to reach more people, to reach more audience in every step. Let's see. Next. So Tanya Marlo is actually developed by UNAIDS in 2018 with the objective to provide comprehensive HIV information for young key populations at the time, and also to reduce stigma and discrimination related to HIV and AIDS. The features that actually provide the which is chatbot in Indonesia. There is the platform that provide chatbot for HIV issue is not exist at that time. So Tanya Marlo provided because there is so many audience, not only young people, but also general populations who want to ask a lot of information, but they don't want to show their identity. So they really hesitate to contact a counselor, for example, or give the direct message. So with this chatbot, we hope that we can help them to give a lot of information through their questions. And also at the same time, to reach audience, Tanya Marlo activated the social media like Facebook and Instagram to promote and to reach more audience and also promote the chatbot. Next. So in 2021, due to some reasons, UNAIDS hand over the chatbot and also the Tanya Marlo to our organizations using PrEP and CBS introduction project. So because in 2021, the government of Indonesia launched the PrEP and community-based screening HIV, and we helped to promote this program using the platform, the digital platform. So it's like a blessing disguise because with this funding support, we can progressively improve the whole platform concept. and activated more social media platform, including Twitters, and also redeveloped chatbot. Because in the first step, the chatbot is quite limited with limitation informations. So with this project, we try to improve it with more informations that needed by the audience. And then we also create more content to attract audience and increase interactions with call to actions is to access the services, not only PrEP and the CBS, but also the test and treatment center. And also with the call to actions from the social media campaign is actually to access more information through the website that we create. Also, we develop the website that become a landing page, and we put a lot of articles related with the issues. And then we also provide the counselors. So through the WhatsApp applications, so the audience who need more information and don't really want to access the chatbot, they can directly ask a question through counselors. And then a partnership with other organizations that support on promoting. So we make a partnership to support the promotions. Next. So, and then in 2020, our organization's partnership with AIDS Fund, with support from the, Xavier Foundations, we implement the step care. Step care mean to connect all the services that actually already existing in our country. Like many organizations actually already have the social media and also a website, for example, but we are separate to each other. For example, GWL has Gue Brani, and then Tes JKT, and then JIP, Indonesia Positive Network also they have, Women Positive Network they have, and the young people also they have. But since we are never connect to each other, so with this project, Tanjung Marlo try to reach all existing platform to work together and to refer to each other. So we refer to each other if there is any needs from the audience related to services. But also we have to broaden the issues not only on HIV and STI, but the comprehensive SRHR issue that targeted to the young people. So the concept of step care encouraged Tanjung Marlo to be linked to another services. So we have to map and then link and then put the services directory in our website. Next. So the result with this project, actually we have the comprehensive website now, and then the chatbot also improved. We used Line for the chatbot platform, and then our social media also progressively upload. So follower also increase and access to referral increase. This is based on interaction with the partners and the audience. Next. So what's new different? Like I told you before, we can make various varied content, mostly related to sexual SRHR, and then offline activities. We go to the school or to the university for promotions, and also to give information about comprehensive sexual education and HIV. And then we make us live at social media, Instagram and TikTok. And yeah, TikTok is very impressive now. Like for example, we do live on TikTok for 1.5 hours that visit by a few, but by 5,200 people, mostly 3.5 minutes. They attend the workshop. And the live sessions, there is a lot of questions from the audience. And then we approach and map the other organization and link to be clinics to be linked. And we start to form coalitions. Next, for the coalitions, we can see.
Just to say 1 minute remaining. Thank you.
Okay. So in 2024, we formed the coalitions. This is to enable collaboration, drawing on expertise and service of each other. Next. So the coalition partners is actually Indonesia Positive Network, Yayasan Intermedica Inti Muda for young people and gay men and transgender and also young sex workers. And PKBI is the Family Planned Parenthood in Indonesia and also Sehat Jiwa for mental health provider. Okay, next. So with these coalitions, actually we support next. Sorry, actually we strengthen each other, creating joint content and sharing it our coalition partners, and then updating the Tanya Mala website, providing online counselings in every organizations, offering peer support assistance based on the audience, young people, young MSM, young transgender, young sex worker and community, and also advocating for case of discriminations by people living with HIV, provided by Indonesia Positive Network, and then also addressing discrimination and provide legal aid, and also delivering clinical services. Next. So this is how we work. So we actually strengthen the partners when we make the content. And then it's not from us, not from Kasih Suwitno, but we work together to make the contents and how we link to each other by make coordinations every month and also through the WhatsApp group. Next. So here's the result. Until now, the digital platform is really effective. We can see that we have a few content that's viewed by more than 1.5 million viewers, especially at TikTok and also in Instagram. And next. So this is our coalition partner. So the content itself also upload by our coalition partner in their platform. So it's really helped to increase our interactions with our audience. Next. Yes, and the next, please. So you can see that's a bit with this digital platform approach. We actually can be efficient and reach more audience compared with the traditional or face-to-face outreach, for example. And we can give information to millions of people only in once, in the step like that. And then the engagement also quite high. If we see the direct message, and also the counselors' communications with the audience, and also at the live session. And also we also have a YouTube channel, and we can see if there is our videos watched by thousands of viewers. And also we have one very good, very high viewers talking about how to have a good sex, like more than 2.5 million viewers with that video. Next. So yeah, the result, we now have more content created with various issues, more audience reach and interacted, more services provided, more audience that access services, and also good quality and health life at the end will achieve by our audience. I think for the recommendation, we will discuss next. Okay, thank you. That's our experience. Sorry for the longer time. Thank you.
Thank you very much, Tono. I think, these experiences that we have by implementing these interventions, I think teaches us a lot and, shows us the way in which, where we can reach the maximum number of people with the most effectiveness. So I think, this has been a very good learning for me, at least, and I'm sure for the audience as well. So thank you for that. Moving on to the next speaker, I would now like to invite Danwick Rosadino from Love Yourself Philippines. He is serving as the head of programs and innovations at Love Yourself, a community-based organization in the Philippines dedicated to providing comprehensive sexual health, transgender health, and mental health services. In addition to his leadership role, Danwick actively contributes to global health policy as a member of various WHO guideline development groups focused on HIV testing, prevention, and sexually transmitted infections. His expertise extends to research and implementation science, where he works on projects related to testing and prevention of HIV, hepatitis C, and COVID-19. Over to you, Danvik.
Thank you so much, Purvi. Again, good morning, good afternoon, good evening, wherever you are in the world. Uh, I hope you could see my screen now. So in the next few minutes, I will be presenting our experience in our organization, Love Yourself, a community-based organization providing sexual health, transgender health, and mental health services in the Philippines. And I would be summarizing my presentation, titling my presentation, Sharing What Works for You. In the next few minutes of my presentation, I will be first explaining the context. Why Love Yourself, how did we create our paradigm or our context or our foundation of how we communicate our services to various communities in the Philippines? Understanding the various needs of our clients and providing context on how we should communicate our services. How did we communicate? Meaning, how do we, understanding the needs of our clients, how did we now generate demand and link those people for them to access the different services that we have, and different some case examples and key takeaways for my presentation. So first and foremost, I would not dwell on this further, but we need to understand, as we all know, HIV is a highly stigmatized disease. This means that since it's highly stigmatized, there are so many issues that are attached to the disease in itself, especially when people accessing to the service. When people walk into our services to access PrEP or access condoms and lubricants, it's not as easy as walking there and getting the service and then going. There's really issues that are attached to the service itself that makes it discriminating for some, and also it promotes stigma and shame for some. And that means we recognize that HIV services now should address two needs. The first one is the practical need. The practical need is when people access the service in itself, when they access condoms, when they access HIV testing, when they access PrEP. That leads them to satisfy their biomedical needs. But when people access specific services, that's where we need to understand that they have personal needs when they access the service. Personal needs may include, if I use PrEP, will I be stigmatized if my partner discovers that I'm using PrEP? Or when my parent knew that I went for an HIV test, will I be discriminated? So these are the personal reasons that we need to address as well when people access service, so that we satisfy their psychosocial needs, to satisfy and somehow effectively we can remove stigma and discrimination on the services that we provide to our clients. And what we did when we promote our different services to our clients is that we involve the clients themselves. We involve the communities in creating the demand generation and the campaigns that we create, because the communities are not only involved in the creation of the paradigm, not only giving suggestions, but they're also the architects of the paradigm, meaning together with them, we develop how did we create our strategies, our communication strategies, our campaigns, and key messages on how we would promote it to the communities. Because as we always say, we know the market because we are the market. We know the interventions that we need to promote, the key messages to say to the communities, because we ourselves, we want to receive that service without discrimination, without stigma. And we know for a fact that we understand each other because we are part of the target market that we want to reach. So that's why we involve communities in creating the response. And from the projects or the activities that we created to generate these campaigns, what we have seen is we need to move ourselves from risk-based messaging to lifestyle and pleasure-based empowering messaging, where we put a stop now to people categorizing them that they are at risk of getting HIV. But it's more of us promoting our services as part of their overall, as part of their management of overall wellness and overall health. So we need to move away from promoting risk to people and making them understand that this is a need for their lifestyle. We also transitioned in using status neutral approach, where we now at the time and age where we could talk combination prevention strategies, regardless of your HIV status, whether you're HIV negative or HIV positive. So that means we could promote stigma-free communications to everyone, to the general population, to the key populations, regardless of who they are. And this means as we reach more people, we need our campaigns to be person-centered and evocative, rather than directive. A directive approach would mean, oh, since you are at risk, you need to use condoms, you need to use PrEP. We are moving from that messaging to an evocative approach where we provide different options for our clients, and those different options, they will decide on themselves what is perfect for their lifestyle. And that means it's more of a participatory approach for them to select the best option for them. And we simplify our messaging that the best HIV prevention option is the one that works for you. As we create our demand generation messages, we need to understand that whether these are offline or online strategies, we need to follow the AIDA model. The AIDA model just simply means that we need to generate a huge demand of awareness activities so that it will funnel down to those people who wants to take action. Meaning we need to generate a lot of awareness activities so that when people are getting aware, there has to have a process so that we could promote to these people that they could act based on the awareness that they need. And this model has guided us on how we plan our key messages. Our different key messages that we create to our communities is not one size fits all. We differentiate key messages for different population groups and different platforms, meaning what we promote on Facebook may be different from Twitter or what we promote to TikTok. So we provide different key messages for each and every platforms to each and every target market that we want to reach. Especially part of this customization is customizing the tone and the feel of the messages that we promote, especially among the young people, where Gen Z and Gen Alpha, they want authenticity and diversity in the messages that they want to view. And it's not just promoting the services by just posting it or just sharing the service. Engagement is more important than mere presence. Where we engage our audience, where they view our content, when they view our videos, when they like our posts, when we engage to them, they would feel that we are more approachable and we could be trusted and we could relate to them. And as I said earlier, we don't force them to do something because what we have seen is that communicating behavior change is actually ineffective. So we need to move into an evocative approach to promote what is perfect for their lifestyle. And when we plan key messages, we need to at least satisfy these three words. Our content should be educational, entertaining, and inspiring. Educational is easy for us healthcare workers and professionals where we could provide correct and factual information. But providing correct information is not easy if it's not entertaining. Because if it's not entertaining, they will not listen to us. So when we promote key messages, we need to use themes, tone, and the feel that will catch their attention and will keep them engaged, and basically answering the question, what's in it for you? And lastly, we need to provide an element in every channel where they will be inspired to do an action plan. Like if they see a content knowing about what the HIV status is, we need to inject a content that will actually empower them in terms of what are the benefits for me to know my HIV status. So we need to include all of these elements in the content that we're creating. So some of the case examples that we did, this first one is our HIV self-testing program called Self-Care. This is the implementation for this demonstration service started in 2020. And the continuous posting of content has increased uptake by 1,012%. And in fact, there are around 500,000 people, clients that were reached by this campaign. Around 20,000 people access HIV self-testing through our various campaigns with a reactivity rate of 6%. Around 40% of them are first-time testers, and among those who are reactive, 90% have been linked to treatment. For our PrEP programs, we customize our key messages based on the target audience. So we have our hashtag Men of PrEP for gay, bisexual, and other men who have sex with men. Hashtag Queens of PrEP for transgender people and gender binary people, and our hashtag Summer Fun Collab. This is our first sexually charged HIV campaign for those people who are are promoting their sexual activities online, specifically on Twitter. With our different campaigns that we created, we generated about 5 million unique engagements in these campaigns. And these campaigns have enabled 17,548 clients enrolled on PrEP with 85% retention rate. And our learnings in promoting all of our services online is we establish an all virtual prep service where we deliver self-testing and prep services to them. And right now we have 430 clients on that service. Our last case study is actually the use of influencers. We have a pool of influencers in Love Yourself, and these are not just macro influencers. There are other influencers where we call micro and nano influencers, with not specifically with the considering the number of their followers, but considering their presence, and they are known to specific communities and groups. So we tap all of these influencers, provided training, awareness activities to them, and ensure that they are part of our referral network when someone messaged to them and they would want to be linked to our services. Our partnership with these influencers have generated around 2,500 unique engagements per month on all of our platforms. And this reflects on the services that Love Yourself receives, where around 85% of people that are accessing services knew Love Yourself online. And this snowballing model that we employ with the influencers has enabled us to serve 50,000 clients per year for HIV testing with a reactivity rate of 12% among key populations. So for key takeaways for my presentation, in generating content, whatever the channel is, we need to ensure that they are all educational, entertaining, and inspiring. And we need to think of the target market. What do they want, where to reach them, and how to reach them? We need to understand that there should be different strokes for different folks. And we need to involve our target market in the design of our services because they can be the architects of our overall service. And as we always say in Love Yourself, that the best HIV prevention option is the one that works for you. We would like to thank all of our sponsors and partners for making all of these possible. And thank you very much. Maraming salamat po for listening to us.
Thank you, Danvik, for that wonderful presentation. I think, something that I learned today, or a new term that I've learned today, is to, have our demand creation campaigns to be more evocative rather than directive. I think that's a new thing that I'm hearing today. And I think it makes a lot of sense because it's very important to ultimately give them the choice to choose what works for them rather than being directive at, this is what we have for you. That's not the approach that today's populations want to really take on to. So thank you for sharing those examples and results with us for more learning. Moving on to the panel discussion. So we have our wonderful speakers on the panel today as well. I'd request people to put in their questions in the chat if you have any, and the speakers would be happy to respond to you. Can we have the three speakers for the panel, please? Tono, Nikki, and yeah. Okay, so just starting on with what we saw in today's presentation, I think there were so many new things that people would have learned today. There were so many new experiences, and as we move ahead, I think there's so much advancement happening with the kind of technology that we've started using as compared to what we used to do in 2019. I think we've moved leaps and bounds. We've started understanding the use of technology better. I think we've started understanding the importance of using technology when it comes to reaching out to these populations, especially for the hidden, the discrete populations who don't really want to come to facilities to access services, and how important it is for them to actually safeguard their identities. And it is important for us as program people to actually provide that option and choice to them. Because without that, I think we're just forcing them into services and to do something that they're not comfortable in doing. So I think let's start with something with that. A question to all the speakers. I think, in your experience, what are some of the most significant gaps in the current virtual HIV services, particularly for reaching the young or the hidden populations, and how do we really address these gaps? I mean, demand creation is one such activity that, of course, would lead to a lot of answers, where we are providing accurate information. But what are the other gaps that you see in the program, and can we really address them with virtual interventions, and how? Anyone can start, maybe, anyone could start. Maybe Danvik, you would like to go ahead first?
Yeah, okay, I'll start. What I always say in terms of demand generation is demand generation is not just generating demand. There should be service acceleration. When we promote our services online to various key populations, and if they discover that I cannot access the service because it's not existing yet, the demand that we generated will just put it to waste. So we need to accelerate how we offer these services as well. It could be promotion of going to clinics, but it also we should enable to make these services accessible to the key populations that we want to target. So that means if we need to demedicalize, we need to provide different options for our clients to access services. We need to create them because if we make our as we generate demand for our services, we need to ensure that our services that we promote are accessible. So I think they go hand in hand. And what I always say is that virtual interventions is not a total replacement for all of the services that we offer, but it's just here to complement to the responding changes in time where we are in a virtual world, but we still have a physical world. So we need to promote interventions of demand generation. They are not just online strategies, but they're also offline strategies for us to do to complement, for us to promote our services.
Thank you, Danvik. I think that makes total sense. I think we've also seen in a lot of programs that a lot of programs stop at demand creation. They do not link those platforms or those services or those awareness messages to actually let people choose the service that they want to go and access. So I think that's extremely important. And as you rightly mentioned, it ultimately boils down to choice, I think, where we are talking of virtual interventions as not being a replacement. We don't want to force people to be virtual. We definitely want to give them a choice. If somebody wants to go and physically access services, that's great, I think, if somebody's willing to do that. So again, it boils down to choice, I feel, So Tono, do you have any additions in terms of gaps that you would have seen in HIV programs that probably could be addressed with virtual interventions?
Yeah, I think I see the gap since the last 6 years. There's our community organizations or community who voluntarily provide information through the digital platform or social media is not really supported by serious funding or serious technical assistance. So they just make like they have a very creative message, for example, but it's the very limited. So and then related with how our demand creation also connect to another services. That's why with this project, the Step Care, actually we try to map and find out many services outside, not only STI and HIV, but also the mental health, TB, or anything else. I mean, Danvik has for me, and friends in Filipina is very lucky because they have the clinics directly. So the clinics also provide the demand creation. If they want to go to clinics, they just refer to the clinic, right? But in Indonesia, we are really separate to each other. So that's why we are with our creativity, we try to strengthen this coalition. So every needs from the audience related to the services, we connect them through the information by counselors or by direct messaging or also the chatbot. Yeah, that's what we do. But for me, the gap of support, funding or technical support is really big. We still need support for that.
Yeah, that's so true. I mean, funding barriers actually pulls down a lot of community-based organizations before they can actually scale it up. A lot of people demonstrate it, they do a lot of pilots, but when it comes to scale up and actually, implementing it at a large scale, I think because of funding barriers, we often fall short. And I think it's important that we also involve the government and the national program for more ownership and sustainability of such programs, because as community-based organizations, we are definitely being more innovative. We are bringing out new innovations every day, trying new things. But how do we make this sustainable? How do we make this more inclusive? Not just for HIV services, but as you mentioned, Tono, mental health is equally important for our populations. And, I think government inclusion, involvement, and sustainability is an extremely important role there as well. And that is definitely a gap that we should be addressing.
Can I add?
Yes, please.
So don't just to add to the discussion, I just think I because I myself in doing my work I don't really implement the virtual HIV services anymore. So maybe I'm not as updated as Kang Tono and my friend Anfik. And what I'm about to say, maybe it's not gaps, but what I just see as an issue that in this world that is right now very fast, all the information like available everywhere, the flow information is like overwhelming, but somehow it's we cannot really sure that everything is a verified information, and the young people sometimes it's very hard to where they can find the right information, which information that is really that really fits to their needs. And some information are very old school. Let's say there's in the internet we always see the information not updated, people still always advocating for the use of condoms all the time, while in reality we have PrEP with 99% efficacy available. So and also about sex positivity, like some of the information still think like it's I can't believe this is 2024 and I still see some information saying abstinence from sex because because sex need to be embraced as long as we understand the risk, we and we let our young people to do it responsibly. So yeah, maybe just to put on that on the table. Yeah.
Totally, Nikki. And that is the reason you're here on the panel now to talk about it. Okay, so moving on to the next question, I think as we know, I mean, demand creation is definitely essential, right? For increasing uptake of our services, all the services that we want to provide to our population. Now, based on your experience, what methods of virtual platforms have you found most effective? Anybody wants to start with that?
I think if we want to blow up the issues, for example, and get direct reactions, if we want to see how the reaction from the audience, X is still the best platform for that. But if we want to get audience in the popular way, in Indonesia, the most popular now is TikTok. I mean, and the YouTube. Like I told you before, we use Instagram, for example, and YouTube and Facebook for live sessions, the question and answer. The highest viewers that we got is only 50 to 70 per session per 1 hour. But when we use the TikTok for the first live, I mean, we reach more than 3,000 with 100 viewers standby. On the live session, and in the last time after the 10 session of live session, we reached more than 5,000 with 440 viewers in one time. So I think the TikTok is still very popular. But if we want to put our videos, if we produce videos, because to produce videos also needs resource, not only funding but also the good videos. YouTube is still the best. That I told you, we have the videos about how to have a good sex, healthy sex, and it's viewed by more than 2.5 million viewers. So can you imagine our message can receive by, and also in TikTok we have like 1.6 viewers for one, and another is like 100,000 viewers in our videos. But we have to make the the content should be in videos, because in Indonesia, when we make a content in slide or writing things or photos, it's not really interesting anymore. Yeah.
That's right, Tono.
Mm.
Danvik, do you have any comments on this one?
Yeah, I think to add with Tono's comments, I think it's important to note that when he mentioned multiple platforms, I think it's important to understand for each and every clients that we have, we need to understand their different demographics and their different technographics. Demographics meaning how old are they? Do they have long attention spans, short attention span? Technographics meaning are they active mostly on Facebook? Are they active on Twitter? And each platform has their advantages and disadvantages. Like, for example, on Facebook, even though here in the Philippines, more than 95% of Filipinos have Facebook, we cannot use the word sex in Facebook because it will be turned down. It will be reported. We can promote it on Twitter, but Twitter or X has a different dynamics in terms of engagement. It has to be promoted all the time so that everyone can see it. So I think understanding the different technographics of our target audience is essentially important. Like for example, in TikTok, TikTok is also mostly used by the youth here in the Philippines. But it's not only I completely agree with Tono's statements in terms of resources, but if we produce videos that are not engaging, at the first 3 seconds of the video, you'll just be swiped up. So you have to really plan it carefully. So what we're doing is that we ask our audience, our target audience, who would want to see this campaign. So that's why it's essential as part of pooling the resources in creating these videos is we need to have a session with the target market that we want to reach in our different campaigns. Because that will make us understand who they are and what they want to listen to so that we could create better strategies in communications, better strategies on where we could place our funding. Because there's so many platforms online already. In our phones, we have Facebook, Instagram, Twitter, TikTok, everywhere in just one phone. But we need to understand what are the apps that they're using, what time are they using it, and understanding the usage of the app is really essential for us to create that communications plan that we are very sure that the contents that we post will be engaging to them, and we know that they will be viewing the content that we create.
Totally, Danvik. I think it's very important that we make this campaign as accessible as possible and based on the needs and preferences of our target audiences. I think it also depends from country to country, sometimes region to region, what kind of platform is more popular. Also, population to population. It's not necessary that every population is on the same platform, right? So from population to population, region to region, country to country, there are different kinds of platforms that are more used by certain age groups of populations, by certain populations. And I think it's important to assess that before we actually start a demand creation campaign. And I think consultations with key populations and beneficiaries is extremely important to allow us to capture that and target the correct audience with the correct kind of messaging where they want to be reached. So I totally understand Tono and Danvik's responses there. I just had one more question.
100. Can I add?
Yeah. Sorry, Nikki.
Yeah, it's okay. I completely also agree with Tono and Danfik too. It's the first 3 seconds. Yes. So we usually, it's really, and that I'm not an expert here, but I think that's how the algorithm works, right? So that, that if we create a thumb stopping, if they thumb stop, not scrolling. So that means it's a good content, and that adds to the algorithm. In that fixed presentation, Daphne mentioned about the different key messages, different approaches for different type of audience. Because I really believe that, I completely agree the language matters and how we put on framing, the perspective on things. The idea could be one thing, but to who we want to convey the idea, and that could be like 100 different language or 100 different framing of way saying it, right? Even though like it's one big message or one big idea. So I think the based on my observation, the thing that really work um, the method, right? The question, the method is going up to to what's trending, which I know might be, might be, and I think always will be a challenge for our communities doing work on fetal intervention, because we're talking about HIV, and HIV not supposed to be fun, but how to actually link it with the current trends. That's the tricky way of, but it's not impossible. But because, and then HIV, maybe the topic is quite limited if we cannot really make a link to the trends or make a link to the things outside HIV, then it becomes repetitive. We always say, blah, 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 even though yeah, people will get bored. That's what I'm trying to say. So, and I think the reason why TikTok become really popular, and I have to admit, I don't have TikTok. Maybe I'm that millennial who's not who's not that young anymore. So, why I think TikTok is very popular, because it's really up to the trend. It's really is very grassroots, and people just want to have fun. Sometimes people can just scroll and just look at TikTok. My friends who don't even, I can say, I can say from my friend point of view, he don't even have Instagram or Facebook, but he have TikTok, and he can spend like 3 hours just, looking at stupid and crazy videos. And that's how we captivate the market. Even though, yes, we cannot generalize, but always up to the trend. That's like, that's like an important thing to do and to remember. Yeah, thank you.
Thank you, Nikki. You're like the OG demand creation expert. I think your inputs are so valuable. I don't know why you keep saying I'm not an expert. I'm not an expert.
Oh no.
You're the OG expert, by the way. Okay, so moving on to my last question, I think with the rise of artificial intelligence coming into the picture now, in all aspects of our life, including health programs, what concerns do you have about their use for HIV services? As we know, there are specific risks associated with using any kind of technology. How do you think we should address these concerns to protect both privacy and ensuring that quality of service does not get affected as well?
Maybe I can go first.
Okay. Okay.
Yeah. I think in terms of artificial intelligence, what's important in terms of what information that AI generates now, because AI it has a pool of of searching multiple data sources on the internet so that they could generate correct information. So I think what's important for us now is to generate the correct information and completely dispel false information, because this will teach the algorithms, the databases that AI is currently getting their information to provide correct information to those who are accessing it. But what we are seeing, of course, AI will not make our HIV testing completely virtual. Or I would say the AI will not deliver your self-test kits at home. There needs to have other complementations. As I always say, there needs to have service acceleration. There needs to have the medicalized services. When we differentiate services for each and every one, then AI can generate information that HIV services are completely accessible. So as there are changes in in the virtual world, we need to have a complement in and how we create our physical world, where when people know that services are available and accessible, then we need to make our services accessible and available to our countries. So I think there's a challenge for us in this online world where everything is so fast paced. That would mean for us to respond with resources, with services, and making sure that our services are accessible. And I think we should change our paradigm as well. We should not think of people as hard to reach. Maybe our services are hard to reach. So by changing that mindset, we are able to respond to the fast changing world of AI as well, where they promote that services are accessible, then we make our services accessible. So I think that's one challenge that we're seeing in what we're seeing now towards AI.
Thanks, Danvik. And I think that, I've also seen some great examples of using AI for helping people interpret results, for example. I think, that could be a game changer as well. I mean, it's not just about delivering a self-test kit, but then later what happens with that kit? How easy and comfortable is the client conducting the test and then interpreting it and then getting linked to services? I think that's also a big gap that we currently see and people are concerned about it. So maybe AI, could help us enhance that experience for the client as well. Nikki, any comments?
Yeah. Okay, so I don't go last again, right? So, so of course, there should be like some concern about privacy breaches, data misuse. Yeah, system, it should be transparent with clear data governance policies to ensure our community's consent and confidentiality. Maybe, there should be a setting up of good system or safeguards to ensure that the AI does not it doesn't really replace the human touch. Yeah, especially in the sensitive health context, like the work that we are doing um in the HIV care. Like, because all this safety security might be, it's really important. And for example, um if it's including the questions on drug use, and it might, a breach of the data and confidentiality might pose someone to a risk, not only to their personal level, but also a risk of prosecution, right? So that's why it's really it's good to have that system, but also for the communities who work using AI to understand how the system works. And so and I understand making the system and making the community understand and all that, it's not cheap, the system itself and the training and all that. But we should always remember safety and security to be the utmost one of the utmost priority, so that that trust and confidence from the community can be gained, and then they can have that a totally safe space.
Totally. I think, it's important to reiterate the fact that it's extremely important to make use, I mean, responsible use of AI. It's not just making use of AI to make things faster, easier. It's about how do you responsibly use technology and AI. So I think, that's something that we definitely need to consider. Ethical considerations, governance, those are some things that are non-negotiables, especially for the populations that we reach out to. Tono, any comments?
Yeah, I agree with you, and also Nikki and Danvik. AI is actually created by human, right? So that's I think we have to create more I know, more human. For example, when the first time we operate the chatbot, it's really robotic, right? The answers of the question is like a very short but then we try to improve with our resource, with our creativity, we make it like a human. So, but with the AI, I think what we should do is we strengthen the other services that could give more informations. Like maybe we can strengthen the direct counselings and everything, but the informations we try to make it correct. But I know that we cannot reject or also refuse. Yeah.
You're muted, Tono.
That's how we are what is this our resource is more have more good information and also can connect to the services very well. And about the confidentiality, I agree with you. We are really concerned also about that. Yeah.
Great. I think this discussion has been very productive, and we've sort of shared a lot of experiences, a lot of important considerations while we use technology, etc. So just want to thank all the speakers and the panelists for their extremely important and valuable inputs. There are a few questions in the chat, so just wanted to request the speakers to respond to them as they feel as required. Just wanted to hand over to Matthew for wrapping up and closing remarks. Thank you, everyone.
Great. Thank you so much, Purvi, as well as all of our speakers for taking the time today. It's been a really interesting discussion and hearing from the great work that you've been doing at the field level in both Indonesia and the Philippines, and also the really informative discussion around what's next. Themes like ChatGPT and other aspects of AI have infiltrated, our everyday life, including, our HIV programming. So I think a lot of what you've been saying is really useful to take forward in our work. And we'll be able to share the slides as well as the recording in a few days with all of the participants. And so thank you again so much for taking this time to join us today. And we hope you have a fabulous rest of the day and rest of the week. Thank you so much.
Thank you.
Thank you. Thank you, everyone, for attending.